Hello, this is Dr. Kemp, and this is a video on recovery after forefoot surgery. The forefoot is defined as the metatarsals in the toes, depicted here in gray and white. Common problems that occur in the forefoot are bunion, hammer toes or claw toes, arthritis, crossover toes or plantar plate tears, and neuroma. Other problems can occur, but these are the most common. Please refer to other parts of my website for details on these conditions. On the day of surgery, you'll have nothing to eat or drink the midnight before surgery. You'll arrive at the hospital or surgery center on time. You'll then check in and visit with the nursing team and the anesthesia team. I will see you right before the procedure to answer any final questions you may have. Your choices for anesthesia include a general anesthesia with a breathing tube, a nerve block in which the anesthesiologist uses ultrasound to inject numbing medication in a big nerve behind your knee, or a nerve block with a continuous catheter which will continue to inject medication over a 3-day period to keep your foot numb during that time. During the procedure, you will remember entering the room and moving over to the operating room table. You should not remember anything regarding the procedure or immediately after. You'll wake up in the recovery room, and it will take about 2 hours for you to recover from surgery in the recovery room. Then you'll be discharged home. It's important to note that you need someone to drive you to surgery and to drive you home. This is usually a family member or a friend. I will be discharging you on appropriate pain medication. When taking your pain medication, it is important to start it right away after surgery. Even though you have a numb foot, that block will eventually wear off and you'll have significant pain, so it's important to have some pain medication on board. Please refer to our pain medication policy on the website or ask one of our staff. The most important thing I can instruct you to do when you're home is to elevate, elevate, elevate. This is for 2 to 3 weeks, and your foot should be well above your heart 90% of the time. You may be up out of bed for short periods of time, including trips to the bathroom, up to the dinner table to eat short meals, and while you're awake you should be up every couple of hours to stretch, deep breathe, and keep the blood flowing to prevent clots in your legs. To properly elevate, you need to place your hand over your heart like you're saying the Pledge of Allegiance while laying down, and your foot should be well above the heart, or well above your hand. This is a picture of proper elevation on 3 pillows. Ice can be used at home. I think it's less important than elevation. One thing to note that it's important to use ice only after your nerve block is worn off to prevent your foot from becoming too cold or prevent frostbite. You will be dispensed a post-operative shoe. You may use the shoe when you're up and around. You do not need to wear the shoe in bed or when laying down. The shoe is there for your protection. It is basically a stiff-soled sandal that protects the toes in your recovery period. You'll wear your shoe for up to 3 months. You may heel weight bear immediately post-op or as soon as your block wears off, and typically I keep forefoot patients heel weight bearing for 6 weeks. After 6 weeks, I will typically allow you to weight bear fully in the post-operative shoe for 4 to 6 weeks. During this first 6 weeks when you're heel weight bearing, it's often helpful to use crutches, a walker, or a rollabout. Either myself or my office staff can prescribe these for you or help you obtain them. We do have crutches in the office. Your foot must stay dry in order for the wounds to properly heal. This is typically for 6 weeks until your sutures are removed or your dressings are discontinued. The best way to keep your foot dry are commercially available cast covers available at your local pharmacy. Your post-op appointments are typically scheduled as follows. Your first visit after surgery will be 5 to 7 days after surgery. Then you'll visit with me every 10 days after surgery up to the 6-week point. Then every 3 weeks up to the 3-month point. Then typically as needed. I'll modify this schedule based on the specific needs of each patient. In your post-op visits, I'll perform dressing changes. This is a good example of a bunion or a first toe fusion dressing. I'll typically do your dressing changes for you for 6 weeks, but sometimes at 3 weeks after your sutures are removed, I can teach you to do these dressings so that you can take them off every 2 to 3 days to shower. Stitches are removed at your 3-week appointment. If you have pins coming out the end of your toes, then those are removed at the 4-week appointment. A lot of people build up anxiety related to pin removal. I promise you that it's really not a big deal, and it's often less painful than having sutures removed. Swelling is normal after surgery, and swelling can occur for up to 6 to 8 months after your surgery. It is normal. It's also normal for some discoloration to occur, such as bruising or a purple color. This will slowly resolve over time, and typically after 6 to 8 months is completely resolved. Some tricks to decrease swelling include elevation. Foot massages can be helpful after 2 months post-op. Physical therapy is very helpful, and compression stockings are also helpful. These can be obtained at your local pharmacy. It's important to exercise your toes and your ankle after forefoot surgery, and typically wiggling the toes, specifically curling the toes down, is very important. Moving the ankle up and down helps control swelling as well. I will give you procedure-specific exercises depending on the type of procedure you obtain. One of the most common questions I get asked is, when can I go back to work? If you work a sedentary job at a desk, then you can be back to work in 2 to 3 weeks. If you're on your feet all day, then typically you'll need 3 months off unless they can find a sedentary position for you. Total time to recovery after forefoot surgery is 6 to 8 months. This seems like a very long time, but I consider you recovered when you wake up in the morning, you put your foot on the ground, and you don't feel pain, and you don't think about your foot. This can take 6 to 8 months. You must be committed and dedicated to surgery and recovery because of this long duration. It is a long road, but if we work as a team, we can obtain the best possible outcome. Good luck, and thank you for watching this video.